lot of Nigerians do not have access to health insurance.
It's as relevant to the farmer in the village as to the corporate guy in suits in the city.
Not just assume that people know about HMOs or health insurance. Some people don't know about it. Less than 13% of the population in Nigeria have access to health insurance. And healthcare is expensive, yet people want it cheap. How do we break this barrier?
Somebody must pay for it.
So there's no such thing as free healthcare. To any country you are envying that, they have free healthcare there, it's a lie. It's an absolute lie. Everybody is contributing to this.
Because we have a cultural problem. We want good things cheap. There are also people who you know that can afford it, but would rather spend millions doing a party. That's exactly Ashwebi.
Ashwebi 100K.
I'm telling you.
200. But when you now say, okay, 10 physiotherapy sessions cost 200,000. It's too much. It's too expensive. It's not too expensive.
It's not.
Hello there. This is the Sorosoke physiotherapist. You're all welcome to today's episode. Today's episode is actually very interesting. It's out of the usual. I have some special guests here with me today. First of all, I'd like to introduce my special guest. He is Dr. Oyinlola Fashino, a resident surgeon in Lasut. Dr. Fash, you're welcome.
Thank you so much. It's my privilege to be here.
So nice having you on set. So we also have here with me a physiotherapist, the CEO of St. Joseph Clinics, Dr. Osanhan PT. You're welcome, also known as Osanhan.
Thank you very much. Happy to be here.
Yeah, thank you so much for coming. So I'm T-Bash, as you all know, this is Sorosoke physiotherapy. So today we're going to be delving on a very interesting topic, and it's majorly about access to healthcare. Nigerians having access to healthcare services.
Apparently, sweet product isn't the only thing you get at Choco Fresh Nigeria Ltd. You meet sweet people too, and John is one of them. John is the electrician everyone depends on. For over 15 years, he's kept the lights on and the business running.
John, there's an electrical fault in the CEO's office. Can you fix it immediately?
Yes, sir.
Like every workday, he never imagined today would change his life.
The connection is secure, Mr. Adebayo.
And in just those split seconds, everything changed.
My leg! Help! Someone, call an ambulance!
Thankfully, John's company's health maintenance organization, HMO, covered his emergency care. From his consultation to x-rays to orthopedic treatment.
It burns, doctor. I know, but we're almost done. It's looking good. Try not to move it.
And 8 weeks of immobilization in a POP cast.
See, this is a great improvement, Mr. John. The bone has healed well. There's good callus formation.
Oh, that's wonderful news, doctor.
The fracture had
Thank
healed.
you.
But
Doctor,
his elbow had become severely stiff
why can't I move my arm?
after weeks of immobilization. He reported at a physiotherapy department for treatment.
Welcome, John and Chioma. We've been expecting you. Right this way.
The physiotherapy sessions will
thank
help
you.
reduce stiffness,
Can you bend your
improve
elbow as
range
far
of
as you can
motion on the
comfortably?
stiff joints,
And now
increase
straighten it.
muscle
That's
strength,
excellent.
and improve function on the
Just a little
affected
more.
upper
Now,
limb. After only 3 sessions,
So, we need to build on this progress.
Mr. John,
Got your mail. Unfortunately, your HMA only covers 3 physiotherapy sessions. Additional sessions will require self-payment.
luckily, because of his diligence and track record, his boss decided to cover the cost of the remaining 7
Welcome back,
physiotherapy
Mr. John.
sessions. If not, full recovery would have been altered
Wow,
and made
Mr.
impossible.
John. You're making very good progress.
yes, I can feel the difference.
And this is the reality many patients face every day.
We understand that we have several health maintenance organizations, also known as HMOs, where they provide healthcare services, partnering with healthcare organizations, healthcare facilities. However, we notice that a lot of Nigerians do not have access to health insurance. From statistics, statistics conducted, less than 13% of the population in Nigeria have access to health insurance, and this is a big issue. It's a big issue. So these are issues we want to discuss, why HMOs sometimes can or could be a barrier to accessing healthcare, and of course the pros, why it's beneficial for Nigerians to have health insurance. So I'd like to first talk to Dr. Fash. You have experience working with a government hospital, and kindly share your thoughts on this present challenge that Nigerians are facing regarding accessing healthcare.
Okay, thank you very much, Tibash, for having me once again.
You're welcome.
I am particularly happy about the choice of this topic because it's as relevant to the farmer in the village as to the corporate guy in suits in the city. Because in achieving universal healthcare coverage, financing is one of the major issues.
True.
Somebody must pay for it.
Yeah.
Either the patient pays for it, or government pays for it,
exactly.
or insurance pays for it. But we're talking about insurance today. So my first contact with healthcare insurance was when I was working in private practice before I came into the government sector. And it was mixed feelings really, because on one hand, I saw it help patients who ordinarily I know that will not have access to healthcare. But on the other hand, it had some drawbacks, it had some limitations that I think we'll talk about today. And there were patients who honestly preferred not to go through the stress. You have to get cold, you have to defend while you're doing this investigation and all of that. So they preferred to pay out of pocket, which defeats the purpose of healthcare insurance in the first place. So it was mixed feeling, and I still see some of those challenges even while working in the government setting now. Because like I said, somebody must pay for the healthcare, for healthcare. And we have patients who come in who they are not in healthcare insurance. In fact, most people, like the statistics you quoted, but they are not able to pay out of pocket. And those who are in healthcare insurance have to go through some stress. They have to do this, do that before they are able to access healthcare. So it's been mixed feelings for me. It's had its pros, it has had its cons too, but I think it's just been mixed feelings.
I totally understand your point there. So that drives down to the issue where Nigerians, some don't know about it. Don't just assume that people know about HMOs or health insurance. Some people don't know about it. Then secondly, the people that know about it, their experience with HMOs are not so great. So they limit their limitations. In fact, they did like a research in 2024 where they had 3,507 people complain about services with health maintenance organizations, and about 84% of people that complained had their issues resolved, which is a good thing. However, we still need to talk about the challenges. For example, the scenario that was painted about the electrician working in an organization, he was trying to fix something, around one of his the CEO's office. So he had to climb a stool or a ladder, something of such nature. He fell and somehow fractured his humerus mid-shaft. So he needed urgent medical attention. He reported at the hospital where the organization where he works have HMO cover for him. So he reported at that hospital. Of course, he saw a doctor. He was able to access an orthopedic specialist. But he still needed, in the course of management, when someone has a fracture, they had to immobilize that area so that the fracture would heal. And he used a Scotch cast. The Scotch cast was there for about 6 to 8 weeks. After the Scotch cast was removed, he had another problem, a challenge, which was limitation with moving the right elbow. It was stiff in this position. He couldn't do anything. And this is like his source of livelihood. He needs to use his hands. So what would he do? So right there and then, after the POP was removed, he went to see the doctor again. The doctor said, "Oh, you need to see a physiotherapist. It's a physiotherapist that will help you get to use your hands again, and so that your joints can be more mobile, just like you were able to use it before the accident." He got to the HMO. He got to the hospital, and he was told that he only has access to 3 physiotherapy sessions. On getting to the physiotherapy clinic, He did an examination and assessment, treatment plan. You know, the physiotherapist, of course, had planned out his treatment for 10 sessions, because at least having 10 sessions would do a lot of good for us to get results that are productive, for him to get back to doing what he used to do. But three sessions isn't going to be enough. So that brings me to talk to my colleague here, Osahon. He's a physiotherapist, CEO of St. Joseph's Physiotherapy Clinics. This kind of scenario, how has this issue with HMOs affected this kind of patient accessing physiotherapy care? Because yes, he got primary care, he got primary health care at the time where he had the accident. Yep. Unfortunately, he needs more physiotherapy sessions, and the HMO is saying you only have access to 3, and he needs 10 sessions. This is a challenge. So what's your experience with this kind of complaints from patients and clients?
Yes, thank you for the question. Health insurance itself is a big passion of mine, to be honest, because it's the only way to achieve universal health coverage. True. In my opinion. So it's the only way we can pull funds together and make sure that everyone who needs healthcare gets it. So the price of that is that we patients are not exposed to extremes of the cost of care. So because the insurance companies have to protect their business in some way.
Yeah,
so
it needs for profits.
Exactly. So a patient comes to us and we think he needs 10 sessions. The HMO is saying 3. A lot of the time, working with them for the benefit of the patient tends to work. We speak to them. This patient needs 10. Give them good reason. The patient themselves have to understand that we're all dealing with people who want to make progress. And then, of course, there's a bit of back and forth sometimes, but at the end of the day, if we can defend it and they can adjust their own numbers or maybe limit something else and then push for more sessions, it tends to happen if that dialogue happens with the HMO.
HMOs.
So yes, and then we can achieve the range of motion that the painter needs.
The patient eventually is able to use the upper limb or that part of the body. So that brings me to talk extensively, still dwelling on access to healthcare, because we have, over the years, I've had or even seen patients that they need this service, but they can't afford it. Genuinely, they cannot afford it, but they need it. And the truth is, for most physiotherapy, most conditions that would benefit from physiotherapy, early intervention is very key. And then if they start to delay because of funding, money, all that is going to affect the outcome in the long run. And I'm happy that the Nigerian government is doing the best they can to ensure that the National Health Insurance Authority, to ensure that Nigerians have health insurance. So comparing the statistics with other countries abroad, developed countries like the US, the UK, and even, as a matter of fact, in Ghana, they have more health coverage, insurance coverage amongst Ghanaians. You were sharing something about it. Quickly talk about it, about the Ghanaian card or something like that.
Yes, the Ghana card. So what Ghana did was they digitized the process such that it improves access to more Ghanaians. And through an app, and then they've achieved up to 50-60% adoption rates in Ghana.
That's amazing.
So it's kind of cuts across, giving everybody access. Most people, I can say most people at this point, most Ghanaians use their health insurance.
Because they use their identity card. That's like a national ID to access care. So they are leveraging on technology. They are leveraging on technology. Something Nigeria should also learn from. So from research and statistics, about 56% of Ghanaians have health insurance coverage. But in Nigeria, we have less than 13%, which is a huge difference. So there needs to be an awakening amongst Nigerians as to how Nigerians can have access to health insurance so that they can have access to care. Now, so I will also be talking about healthcare financing. I once attended a conference and somebody was speaking, and I see a lot of sense in what he was saying. He said healthcare is expensive, and yet people want it cheap. Yeah, the reason is people want it cheap majorly because they can't afford it. So how do we break this barrier? Healthcare is expensive. Setting up because for a physiotherapy center or a physiotherapy clinic, we have different tiers of physiotherapy clinics or physiotherapy centers. We have tier 1, tier 2, tier 3. So tier 1 is like the low, having like a room, just a few equipment, But to give the best, you will need to fall under either tier 2 or tier 3. And you need millions to set up. I'm talking millions to set up a physiotherapy clinic. There has to be return on investment. And how are you going to get your return on investment? It is through when you charge the clients. And then you are also in business to profit. So how do we this divide, how do we mitigate against losses and at the end of the day still having people not subscribe to the services? So in that conference, the man said something that healthcare is expensive, but people want it cheap. This is why some NGOs or philanthropists can create systems where people can have access to funding for healthcare. I believe Aproko Doctor is doing something of that sort, and I really applaud the Aproko Doctor for doing that because he understands that people need these healthcare services, but they can't afford it. So we need to, like a forum like this, we need to channel our energy into informing the public on the benefits of what this stands to offer the citizens in Nigeria, home and abroad, on having access to care despite the cost. If we have more NGOs that do healthcare financing, where somebody genuinely needs this care, somebody genuinely needs to do a surgery, this person genuinely needs to do a hip replacement surgery, this person genuinely needs to do a knee replacement surgery, this person needs to have a kidney transplant. Do you understand? So once they are able to vet the patient's condition, everything has been examined, and they know that, okay, this is how much this person will need to recover. Such NGOs can fund such projects. Yes, such projects, because we have so many people that have lost their lives because of something that someone can do something about, right? So, for example, also Dr. Fash, I would say that influencers or celebrities like Davido, the likes of Davido, they are philanthropists. They give a lot to help people. So if we, as healthcare providers, we come together, we set up a committee or a fundraising committee for such, I believe it will go a long way. That way, people that genuinely need care, they need healthcare, would get those services. There are some people, for example, that in physiotherapy, there are mothers having to deal with children with special needs. Yeah. It's a long-term thing. Some of them cannot fund that journey of having to take their child for physiotherapy. Do you understand? Regularly, over and over again. Taking care of the child in itself is exhausting, emotionally, physically, and financially. Yep. So if such organizations, funding opportunities or funding NGOs have been created, such patients or mothers or parents can benefit from that. So that's why we want to encourage philanthropists to invest in things like this so that people can get the care that they need. So Dr. Fash, what would you have like to say about the healthcare financing? Have people having to give a pool of funds to help people that need such services that are quite expensive. What would you have to say about that?
Okay, I think I'll start by first saying that that statement, healthcare or quality healthcare is expensive, is very true.
It's true.
And I think it's a truth that many Nigerians have not come to terms with. If you want something good, and that cut across all sectors, including healthcare, the personnel have to be paid, overhead costs has to be taken care of, equipment and all of those things. So the truth is that to solve this issue, I see it as more of a comprehensive approach. Yes, we can have the philanthropists come in, have a pool of funds, But we also have to think of sustainability.
True.
So I mean, there are other things, so many other things that philanthropy funds has to go to. It has to go to so many other agric and entrepreneurship and all of that.
True. There has
So
to be a balance.
there has to be a balance.
There has to
So
be a
when we talk
balance.
about sustainability, yes, we can have those pool of funds, and I know that there are philanthropists who already do that, both global philanthropists and here in Nigeria. You mentioned some few people. But I think that at the same time, government has to play its part. And I think that I really want to commend the government for the recent act they did in NHIA Act in 2022.
Yes.
It gives more oversight over these HMOs. Gives more power to the government in giving that oversight role. And then many Nigerians may not know, but they've actually mandated it that Nigerians should have health insurance, which Lagos State has now domesticated.
Yes, they call it
Ilera Eco. I've signed up for that as a civil servant here in Lagos.
Yeah.
So I think that on one part, the Lagos State government, the federal government have done their part. On the other part, Nigerians to also have to adopt a culture, because we have a culture problem. We want good things cheap. So I think that we need to change that mindset. So, and yes, there's a part where the spending power is affected. But there are also people who that can afford it, but would rather spend millions doing a party than that's exactly Ashoebi. Exactly.
Ashoebi 100K.
I'm telling
Ashoebi
you.
200K.
And then
But when you now, sorry, Dr. But when you now say, okay, 10 physiotherapy sessions cost 200,000. It's too much. It's too expensive. It's not too expensive.
It's not.
It's not too expensive.
It's not. So we have that cultural problem. So we Nigerians, including myself, we also have to adopt. So I think when we look at it that way, a more comprehensive approach, the philanthropist, the government, and we the individuals, I think would achieve something.
Absolutely. I agree with you. Because the government also plays a key role in ensuring that Nigerians get adequate care. Yes. And one thing I really admire about what the government is doing is that government hospitals are staffed with highly skilled professionals. So that's an advantage.
Already.
And they get care at subsidized rates.
Yes.
So that's a plus from the Nigerian government, from the federal government, and even from the state governments as well. Yes, state governments as well. So that's a key role that the government is playing with having people get access to care, because it's highly subsidized. You can imagine if a patient comes to a government hospital for physiotherapy services, they could pay, let's say they pay 25,000 for 5 sessions in a government hospital. But in a private setup, 10 sessions could be 300,000 or 250,000 or 200 or thereabouts. Because in private setup, you have to pay salaries, you have to overhead costs. So a lot. There's a lot. So people need to understand these things and then stay in a place where they can benefit and of course, whatever health condition they need to manage doesn't spiral into something else because they say they don't have money. No, they should get the help that they need per time. At this point, I would like to talk about Peak Line Care. Peak Line Care is the sole sponsor of this podcast. Peak Line Care is a physiotherapy center here in Lagos, Nigeria. We attend to individuals who have issues with mobility. They have problems with pain, movement, inability to use a certain part of their body because of pain, weakness, or limitation. Peak Line Care is the place to be. So if you have any of these challenges, kindly call the numbers showing on your screen or check on our website or the email displayed on the screen. Send us a message if you need more. Thank you. So Osaho, I would like to just briefly touch on the healthcare financing, funding, how this would improve people reporting for physiotherapy services. Because yes, a lot of people say this, that physiotherapy services is premium. Yes, it is premium because the things that we use for our patients, they are quite expensive, and the courses that we do to upgrade our skill and knowledge are also very expensive. So we need to also make profits. That's why I made mention of the fact that having access to physiotherapists in a government establishment is highly subsidized. So from a private physiotherapy practice owner, kindly shed more light on the benefits of healthcare funding, how it would even help physiotherapy practice for people that need physiotherapy services.
Yes, so as regards healthcare financing, I think like Dr. Fash said, the money must come from somewhere.
Yeah, true.
So there's no such thing as free healthcare.
True.
So any country you are envying that they have free healthcare there, it's a lie. It's an absolute lie. What happens is that everybody is contributing to those pool of funds so that everyone who needs it can get it. So the money has to come from somewhere. It's coming from your pocket, whether or not you need it. If you pay your healthcare, your insurance fees today, your neighbor needs it tomorrow, you might need it next tomorrow. So that's how the healthcare goes round, right? In countries where they have good access to healthcare, it's not free, right? So that's why I like what the government did on a federal level and on a state level to make sure that everyone is contributing something. Because that something would help you or someone you know or love tomorrow. So that's the difference, right? So it doesn't matter if everybody contributes 5% of their income. That 5% is more than enough. It's more than enough to take care of all the healthcare needs for everyone, to be honest. But no one wants to. Everybody feels like, whenever I'm ill, God forbid it, but whenever I'm ill, I'll pay out of pocket, right? God forbid is the biggest competitor to health insurance. It's the biggest competitor to health insurance.
Sorry to interrupt you. There was a particular video I watched, and the person was actually speaking Yoruba, but let me speak Pidgin so that you can understand the context. The woman came to see a doctor, and the doctor asked her that, do you have hypertension? She said, God forbid. God forbid. Then he now said, do you have BP? She said, yes.
You see, there's an education problem there
so
too.
Like, the education too is another factor. People are not educated on these things. Go on.
And the best part of health insurance, I know I fight with them all the time, right? But I still push it everywhere I go, because whatever premium they ask you to pay, you have access to 10 to 20 times that amount back. 10 to 20. So if you think you're not paying for health insurance because you are saving money, it's a lie. It's an absolute lie. You can pay 10,000 and have access to 100,000 or 200,000 of access to healthcare. And don't also forget, especially in the private sector, we see it a lot, where people have a better health-seeking behavior when they have health insurance cover. They have a small cold, they get it treated. They have a small wound, they get it looked at. But when you don't have a health insurance cover, you're thinking of your pocket. I rather buy food.
You think twice.
Do you get it? So everything you want to manage, right? So at the end of the day, because you have a health insurance cover, whether it's out of pocket, whether it's you paid for the cover yourself or your organization paid for you, you tend to go to the hospital more. You carry one child has cold, you carry all three. That's what they do, right? So the pediatricians do this.
My organization is paid.
Yes, now they'll tell you, I'm sure the others will get it.
The others will have it too. I've experienced that a lot.
It's really not fair on the HMOs, to be honest. But at the end of the day, the health-seeking behavior is important.
It's better,
It's better, right? So things are cut. So, for example, most HMO covers cover emergency care. They cover screenings. So basically, if you do your regular maybe annual checks at the beginning of the year, you can find anything very early and save cost for everybody.
Exactly.
You can find something early with an X-ray and detect it early, right? So save the HMO money. Everybody wins, right?
It's beneficial.
Yeah. So that pooling of funds is very important, and in physiotherapy specifically. What happens to the whole industry, and even healthcare, to be honest, not just physio? What happens is when this money comes into the HMOs, when this money is pulled together, what happens now is that the private and public businesses thrive. Because everybody is coming. So instead of you waiting for out-of-pocket patients, two of them, you see 20. So your business has more cash flow. You have more cash flow to get things going. So more people come for physio because they have access, and then your business has improved cash flow, and that can help you. Oh, do you know what? I've opened one branch today. I'm opening 2. I'm opening 3 because the cash flow is good. And so the HMO systems and the health financing systems, that is the major health finance system. It helps us to get money in the healthcare system.
Yeah, absolutely.
Get us healthier. So
I agree with you. I agree with you 100%. In fact, when you are even seeing more of the HMO clients, you may even get referrals.
Yes.
From such clients.
Oh yes.
Then out of pocket patients,
they come
and
that's
they pay.
Yeah.
So it has a ripple effect.
Yes.
It has its benefits.
Domino effect.
Absolutely has its benefits. So there was a time where organizations had retainerships with certain healthcare facilities, but that isn't as much as before. So that seems to be an issue now. where they say, oh, we don't have retainership with hospitals anymore, or it's the HMOs that we're using now. As at that time, they call this preferred provider organization, where they deduct the amount for healthcare from the person's salary, and anytime the person needs any kind of care, they have access. So there aren't really limitations with this kind of arrangement, with this kind of insurance, healthcare. Yeah, there isn't really any restrictions, because they can also have specialists. They can also have to see specialists, as opposed to HMOs, where once they see the primary care provider, they may not need to see a specialist, or even if they need to see a specialist, the insurance may not cover seeing a specialist. But that's other kind of health policy can cover seeing specialists. So if organizations can afford to have retainership with hospitals or healthcare organizations like screening centers, labs, diagnostic centers, or even physiotherapy centers or physiotherapy clinics, having direct retainership with them, so that when their staff, members of staff, need such services, they can access the care directly, and the company pays the physiotherapy company directly or pays the hospital directly. So this improves, access to healthcare in the long run. So before we round off, I would like to touch on the fact that many of them have pros and cons, but I will dwell on the fact that it is important for everyone to have health insurance. Yes. Whether HMO, whether NHIA, whether Ilera Eco for Lagos State Government, it is so important. In fact, I thought of something. Some people also do this thing they call health indemnity, where they save up money. They are, more like you are not praying for something bad to happen, but you're just saving up money, starting up money just in case anything life happens to people. So you have money started up with an indemnity as a form of for health, as a form of insurance, so that if anything does happen, you have access to a pool of funds. They pay entirely for everything because you are saving up for it, just like people save for life insurance and a car insurance.
And it has tax advantages too. The health savings account.
Yes,
tax advantages.
It has advantages too, so people can take advantage of that, because life can happen to anyone. For example, we in fact, a lot of young people are having stroke these days.
Yes.
You are just wondering, how did this happen? So it's also important that, like Osanho said, go for your health screenings. It's so important. If you're having high blood pressure, you can quickly nip it in the bud on time.
Yes.
So now, this person is a young person, a 35-year-old, suffered a stroke and has to have physiotherapy for like 6 months. Of course, physiotherapy is not cheap, but he needs it. Physiotherapy is what is going to get him back to do what he was doing to function before he had the cerebrovascular accident. So at that point, if such a person has that pool of fund, he can take from that and, okay, I need to get this done. But if the person doesn't have money, he now has to start begging people here and there, I need money. Time is of the essence when it comes to stroke and physiotherapy. Once you start physiotherapy on time, the outcome is very good.
Amazing.
It's very good. The prognosis is good. The patient is up and doing almost like real soon. But the moment you start to waste time, the outcome may not be very favorable for that patient or that client. So it's so important to ensure that you take health insurance seriously. It's so important. So we're going to be bringing this podcast to a close. I'm sure you learned something and this was very insightful. Thank you so much for joining. I'm sure it was very insightful. Thank you so much, Dr. Fash.
Thank you for having me.
It's a pleasure. My pleasure.
It was really nice. The Sorosoke physiotherapist. See you some other time. Bye.
Bye.